Back with you tonight. The National Institute for Communicable Diseases says there has been a sharp increase in influenza cases over the past few weeks in South Africa. The Institute's Cheryl Cohen adds that the increase in influenza this summer is likely as a result of the relaxation of non-pharmaceutical interventions combined with other factors such as reduced immunity because flu has not circulated since 2020 and 2021. To talk to me about this and the impact, of course, of this on the fight against COVID-19 is Virologist Professor Barry Schoub. Prof, good evening. Good to have you with us tonight here on In Focus. The exact timing of this in summer for many is a little bit of an anomaly. I mean, of course, you do get flu now and again in summer, but do you generally see this degree of a spike?
Yes, good evening, Talbot. No, I must be honest, this really took us by surprise. You know, when I say we, the National Institute for Communicable Disease, the NICD, have been monitoring flu now for decades, 3 or 4 decades. And as far as I can remember, this is the first time we've had really a kind of an outbreak, uptick, a spike, influenza in this season. You know, we're now well into our summer season. Now, flu is really a disease of the winter. So this took us by surprise, but I think we actually should not have been surprised, as you just mentioned just now. I think there are really 2 reasons why we've had this. The one reason, of course, is because it's really related to COVID. We haven't had flu in winter of 21 and winter of 2020 because of all the precautions that have been taken to prevent COVID. And it's the very same prevention measures which will prevent influenza as well. But the kind of downside of that is that, of course, there's a buildup of susceptibility. Because that virus hasn't been circulating, people haven't been infected and people haven't developed immunity. So there's this buildup of susceptibility. And as you just mentioned just now, relaxing all our preventive measures because COVID has come down. What takes its place? Influenza. So it really is not too surprising, although it did take us by surprise.
Yeah, with the 4th wave on the way, are doctors bracing themselves for a potential, they call it a twindemic of flu and COVID-19 spikes?
No, I don't think that's going to happen. I'll tell you for 2 reasons. I think the one reason is influenza and the other reason is COVID. If you look at influenza, those outbreaks don't last that long. They last maybe 4 weeks, maybe 6 weeks, tops 6 to 8 weeks. And I don't think there's an expectation of a 4th COVID wave that's going to come before then. So I hope I'm wrong. I hope I'm not wrong, I should say. We don't want the 2 together. So we hope that the influenza outbreak will die down before we do have a 4th wave. And I think we are going to get a 4th wave of COVID, but hopefully that's going to be after the influenza epidemic dies down.
Yeah, I mean, because of, as you mentioned, the COVID and the flu season that didn't materialize, a lot of people did not go and have their influenza vaccines. Is it too late now to get your flu shots?
Well, look, you know, it's never too late. I mean, it'll take about 2 weeks to 4 weeks to actually get immunity. So it's getting on the late side, obviously. That's the one thing. The other thing is that I don't think that flu vaccines are going to be that easily obtainable now. You know, we normally like to immunize against influenza well before the flu season. So that's about March, April, maybe heading into May before the winter season. And then the flu stocks are usually used up pretty much going into the winter season. From a purely medical point of view, it's never too late to vaccinate. But I doubt whether it's going to be that easy to get flu vaccine now.
And is there any benefit that comes with having had COVID and coming out of it when it comes to flu?
No, these are 2 completely different viruses. There's no what you call cross immunity. If you had influenza, it's not going to protect you against COVID. If you had COVID, it's not going to protect you against influenza. These are 2 completely different viruses, completely different vaccines.
Now, of course, with the symptoms that are almost similar, what would you then advise doctors to do, but also patients to do? Because I suppose in this time of COVID-19, when you go to a doctor and you report these symptoms, the thing that they'll test for is COVID.
Yeah, Tabo, this is one of the problems because certainly the clinical features really overlap each other. They're very, very similar. There are 1 or 2 little differences. For example, with COVID, one of the striking features that one loses one's sense of taste and smell. That doesn't seem to be a feature of influenza. But other than that, it's really an upper respiratory infection, the coughing, the temperature, and so on, which you get with both. And the only way that you really can distinguish them is with a laboratory test, taking a specimen and sending it off for diagnosis.
It's time, I suppose, to go back to our good infectious disease practices of the last 18 months. And that's, I suppose, the only way that will help us.
Well, you know, these practices, these COVID preventive practices, which we, for example, in 2020, we didn't have vaccine then. And they had a marked effect in reducing, quite markedly, quite drastically, reducing influenza. So it's those very self-same practices. These are not specific to COVID. They're really practices which prevent respiratory spread of viruses. So it'll hold for COVID, it'll hold for influenza equally.
Professor Barry Schoub, appreciate your time, and thank you very much for joining us tonight, Professor Barry Schoub.